one-man marketing team. Look, I've been in this business for a long time, and I give a lot of shout out to all the companies out there who have that one man, one woman wrecking crew. Well, where you do everything. You're the marketer, you're the payroll person, you're the administrator, or you're the director of nursing. Look, this business, the businesses that we're in, a lot of small businesses have started up from small to becoming really large. But what makes a difference is this. The small business does not want to expand themselves. If you want to compare your company, if you want to ultimately be able to be successful, a business is not a business unless people are working for you and doing things that you're doing. Now, there is a lot of reasons why a lot of small business or one-man, one-woman wrecking crew organizations are out there don't want to transfer or pass along their business or their current work. Let's say they're the administrator, or let's say, for example, they're the marketer especially. Well, they feel that nobody can do it better than they can. Now, of course, that is true. I really believe in that. I believe that myself. But in order for me to become successful, in order for me to be able to open up all the different businesses that I have, I'm going to have to make sure that I hire the right people. So let me talk to you guys just about the marketing aspect of things for now. I've spoken to a lot of owners of home health agencies and home care companies, and there's like three things that they think about why they don't want to transfer or hire another marketer out there to promote their companies. Whether he didn't want to give up the commission, all right, or he didn't want to give up more of the profits that he can, because he's thinking, if I hire somebody, I'm going to have to pay them $30,000, $50,000, $60,000 eventually, and that money is going to leave my organization. Or he or she doesn't have experience in hiring the right person and doesn't know how to structure the payments for that person, the salary for that person. He thought that maybe hiring a marketer would cost him more money than would be worth to him, because he's heard or she's heard the stories of home health agencies hiring the wrong marketer, and they end up wasting money. Now, the reason why people make money or make mistakes with their money on hiring other people out there is because they do not do or do not create a correct hiring process. Look, I myself have hired the wrong person, and that's why I've created these processes to make sure that I can go ahead and assess somebody before they start working for my organizations. Now look, companies out there, the multi-million-dollar companies out there, they do these processes. They make sure they assess people, but ultimately, most of the time, at times, you're still going to have people fall into the cracks, and you're going to end up hiring the wrong type of person. That's where management goes. That's where assessment tools keeps on going, because just because somebody is working for you, that doesn't mean that you don't assess them. You want to be able to look into what they're doing and make sure that quarterly you do this. Look, everybody that has worked for my organization now, not then, now that what I've created a successful organization is this. They have 3 months to be able to prove themselves. Every 3 months, they're going to get reassessed if they are doing what they're supposed to be doing. I'm not going to keep them around if they are causing problems or if they cannot deliver what they can. Now, a lot of your HR, human resource companies out there, the human resources department of your organizations is going to, raise hell right now by me saying this. But look, how much more money are you going to lose if you keep the wrong person in your organizations? How much are you going to lose? Now, if you're going to worry about you having to pay, for their unemployment, how much are you losing by having the wrong person working for you? You're preventing growth for your organization. So you might as well cut ties now and make sure that you bring in the right person. So for you to even avoid all that, let's go ahead and start weeding out all the bad people from applying into your organization. So what do I look for in a marketer, in a salesperson, in a liaison to be able to bring them out there and have them make sure that they can deliver what they need to do? Okay, so let me share with you guys what are the qualities I look for when I'm actually hiring a marketer. or a salesperson, or actually anybody that I want to be able to be working with me in my organizations. You want somebody who is able to have a conversation, not just respond yes or respond no when you have that initial conversation with them. You want somebody who's able to be able to speak to you correctly. You want somebody who's able to be able to deliver any answers in a clear, positive manner. You want a person who is a go-getter. Now, when you want a go-getter, you want somebody who's going to show initiative on doing things. And to be able to find these things out, to be able to find somebody who is a great communicator, and also understand this, you don't have to hire a marketer who's an experienced marketer in the healthcare setting. I've actually done it where I've hired people from Starbucks because they have a good personality. Because ultimately, look, you can train people. What you just need to do is you need to find somebody who has a positive outlook in life, a positive things, and is willing to learn new things. And ultimately, in order to be able to have a good team, you need to be able to have a good process. You better have good programs. You better have the right materials to be delivering to them. And once you have all those, you can then bring in somebody and train them. One of the biggest mistakes that agencies make is they keep on looking for an experienced marketer. Go ahead and go to Craigslist, go to Indeed.com, look for healthcare marketers jobs that are being wanted, are being posted. If you look in there, they want previous experience. Look, the best marketers out there are not going to work for your company because they are currently happy with their company. And their company, if they are a rock star person and delivering referrals to them, they will do everything to make sure they pay them well. Now look, you can bring in an experienced marketer if you actually provide them training. And obviously, whether you're a marketer right now in training and you're watching this video, or you as an owner, an administrator is looking to hire someone to work with you, that's why you're in this video right now. So if you have the proper training, and when we say training, don't just give them a couple pieces of paper. You want to be able to fully explain to them and train them, and that's what this video series is about. What you're going to have to do, go ahead and make sure that you let them know what their product is. First step in marketing is a person needs to know. A person needs to make sure they are aware what products that they are selling. They need to know from top to bottom, what is home health? What is home care services? If they do not know the product, then how are they going to be able to deliver it out there? So first thing steps, when you hire somebody who's a go-getter, the first thing you need to do is make sure that they are aware of the product. If they are an experienced marketer and they say they're an experienced marketer, put them in the spot. Put them in the spot and tell them, okay, tell me the full 20-minute pitch on what home health does, what home health is, what have your previous home health agencies done to prove themselves. By you asking these questions, you're putting them in the spot because ultimately, this is what's going to happen for them. They are going to have to talk about your home health agencies. They're going to have to talk about your services. And that's where it goes when you interview new marketers. They are able and they need to be able to deliver the information about your company. If they are not good at doing that, if they cannot properly or clearly deliver that, they're not right for your organization. Look, just because a nurse has a degree, they need to get a license still, all right? And just because that they have a license, that does not mean that they're great nurses, okay? There's people out there who have degrees, who have licenses, but does not have a clue what to do in their business. I would rather hire a marketer from Starbucks, a marketer that's working in McDonald's, and be able to train them, all right? Train them positively and train them and help them and guide them. Because look, practice, drill, and rehearse. When you have marketers now, when you have people working for you, they need to be practiced, they need to be drilled, they need to be able to rehearse with you on a continual basis, on a daily basis. Look, one thing you need to do is they need to be able to know the product and the basic of the product of what home health or what non-medical home care is. The next thing is they need to know what services your company offers in addition and how to be able to deliver that. Once they know the product, then they need to know how to be able to reach out to the proper people. So you need to train them, or you need to train yourself and learn how to find the right people to market to. Look, if you're a home health agency that's servicing seniors, are you going to market yourself to 20-year-olds and 30-year-olds? No. So you want to be able to learn how to qualify and quantify the people that you are actually marketing to. And then you want to strategize. Look, if you have a marketing day today, let's say today is Monday and I am marketing today, I am not going to go from one company and then drive 20 minutes, 30 minutes down the other way and visit another company to market to. That means I'm only going to be able to present 2 companies in one. No, I want to be able to strategize my team and give them a demographics. If I am marketing, let's say, in this area, I am going to make sure that I can actually deliver my information or go door to door to 4 or 5 locations in a matter of an hour. If you can strategize it where you have office, pretty much physician groups in one building where you can visit multiple in one, do that. You want to be able to maximize that, okay? So that's how strategy is, finding the right people to market to and making sure that you minimize time and you don't lose time at all, okay? That's the next thing. Now, once you're able to go there, to be able to maximize the time, to be able to strategize that, you now know where you need to do, where to market to. The next question is, can you present well? And that is what we do here at Home Health Success Academy. We actually have our own session, our own video series that literally will walk you through how to present properly, how to be able to create a presentation and deliver that correctly. Look, if you can get into the door, if you don't know how to present, you're going to lose your influence. You're going to lose the potential positive persuasion that you may have had. A lot of salespeople are out there, are good and knows where to target or who to target. I'm sure that you are a person that knows who you need to target right now. But the question is, can you present properly? The presentation part is the biggest problem that you need to do. Now, once you are able, and once Home Health Success Academy gets here and is able to help you as a marketer or your other marketers that you're hiring create presentations, the last thing you need to be able to learn is closing. Look, when you close a deal, just like on any sales problems out there, when you're able to close a deal, the closing part of the sale, the closing part of your marketing to these doctors, to these physicians, to these social workers, to these discharge planners means that you got their business. Look, they can go ahead and say, yes, we're going to start referring to you. But what if they are not referring to you? You have not closed the deal. Look, people all of a sudden stop what they're doing the moment that a physician says, we're going to start referring to you. What you need to do is you need to be able to learn these techniques. Look, you're going to hear a lot of objections out there. And you're going to hear all these objections and learned objections. Look, there's physicians that are going to say, I don't have time right now. Or we don't refer patients right now. Or we already have a home health agency we're referring to right now. Or I don't have the time to speak to you. I don't have the staff right now that's going to be able to help you. Look, these are all objections. You will be able to learn every single objection. We're going to bring up every single objection that we faced, that we have heard from other marketers out there, and share with you guys how to be able to respond to it. Look, if somebody says, I don't have time, that is just an excuse. That is just an objection. You need to go past that. Look, you already made the time. You put yourself in front of that physician, in front of that referral source. What are you going to do? Walk away and say, that's fine. I'll just send you my information. Or that's fine. Here is my brochure. Here's my business card. Or that's fine. I'll leave it here at the front desk. Can you just make sure that Janet in the office gets it? No, you need to be able to learn how to go past those objections and be able to close the deal. And once you're able to close that deal, once you, let's say, for example, are getting a referral or got that one referral, what are you doing next? Are you following up? So you need to be able to make sure a person learns how to follow up continuously. Look, you're not going to get a yes automatically. In the marketing industry, it will take between 5 to 12 contacts before someone will specifically say yes to you. So what that means is you're going to get several objections or no's before you can get a yes. What we want to be able to do is teach your marketers by practice, by drilling, by rehearsing. And if they're able to practice and already experience the objections and is ready to say what they need to say, then you will be able to increase the chances of getting those referrals. Look, football players are practicing in the field, right, during practice time. Why are they doing that? Because when the game starts, they are ready to do what they need to do. Look, we are in a profession just like football players, just like basketball players, just like hockey players. We need to practice, we need to drill, we need to rehearse on everything that we do, both nursing and marketing, so that when we actually get into the field, get into the game, all right, the game of marketing, the game of sales, of healthcare, of home health, we know how to perform correctly. If they present a block, we need to go and learn how to go past that block, to go over the hurdles, to go around the hurdles, or pass that to another person to continue on. Look, this is what healthcare marketing is. A lot of people out there says that all you need to do is be passionate, be caring, and show that you mean what you mean. Look, that is great. But the ones that are winning, the ones that are getting the referrals are the ones that know how to follow up. How to follow up, how to present, how to close, how to sell, how to find the right people. Okay? And the one who has the guts to go out there, who is not scared to get a no. Look, I have had thousands of no's flung at me, thrown at me, yelled at me, right? Mails left at me, my door saying that no, no, no. But look, it's what you do in order to go past that no. And don't look at it as a no as just it's over. You wasted your time already there. You know that they have patients. Who cares if they're giving patients to other home health agencies? You know your company is better. You know you provide better products. When you know this, then you should get those referrals. Look, don't waste your time in marketing if you're not going to want to ultimately get the best part of it, and that's closing and getting those referrals. But in order to be able to get those referrals, practice, drill, rehearse, and know and learn and be a professional at every aspect of things. I have seen amazing marketers out there. They're good at prospecting, they're good at presenting, they're good at knowing their product, but they don't know how to close the deal. Ultimately, they're going to fail. If you're not going to be able to learn how to ask, you're not going to be able to receive. So ultimately, what we're looking for in a marketer, somebody who's able to be molded and trained and is willing to do it. Somebody that is going to be able to be a go-getter, be able to speak clearly, deliver the message. Someone who wants to be successful. How to be able to do that. When we hire marketers, we put them through a rigorous training. Nurses, they go through education, through school for 4 years to be able to learn the basics of what they need to do. And eventually they're going to need experience in the field. And they're going to have the great mentors. So make sure when you hire a new marketer that you are able to mentor them. You need to be able to ask them, what are they facing in the field? And that's what we do also in Home Health Success Academy, is that when we train marketers, when we get hired by other home health agencies to train their marketers, we're available to them every week. We're there. They can contact us. They can email us. They can call us. And when they face certain problems, we can kind of navigate them with our experienced consultants, our experienced marketers. If you decide that you have your own team, you need to be there for them as a resource, as a person, as a mentor. Look, they are going to be facing a lot of different things out there, and they need to be prepared with what they need to do. all the successful home health agencies out there, these successful home health agencies, they have their marketing team and sales team. They have their liaisons out there, but they also have a marketing manager. Somebody needs to be a person who's in charge to manage your marketing team. Look, you have your director of nursing or your supervisors that will supervise your nurses to be able to take care of their patients. If I'm correct, that's how it works when you have a medical home health agency, or you have a person who's in charge of your caregivers, your staff members. You need to be able to have somebody who actually handles your marketing team. Look, you may have an amazing company, but if you don't have a great marketing team, if you don't have somebody who can bring in the patients, to bring in the referrals, how can your company go ahead and provide the great services that you guys claim to have? Your marketing team better be on point. If your organization is going to be successful, you need to invest more in your marketing aspect of things in acquiring new patients. This is where the most of your money, the most of your profit should be invested in. It should be invested into how to get more referrals, how to be able to get more leads. Ultimately, that is the business that we're in. Why are we sticking to just trying to find out ways to take care of our patients? We can find so many different things to add. We can go ahead and add so many products. We can add so many programs. But if you don't have anybody coming in to be taken care of, what use is that? So once again, look, hire the right marketers. If you don't know how to hire the right marketers, let us know. We can go ahead and do the interview for you and help you. Or we can show you how to do things. And there's several questions you need to do in order to be able to get and to know more about that person. Once you're able to interview them and you found a good person to work with you, make sure you train them. Make sure that they are aware of the products and services. I cannot say any more about this. Over here at Home Health Success Academy, we have our virtual marketing assessment program. We have our virtual marketing managers who can be there to make sure that we follow up with your marketers. In addition to that, you don't just want to be able to be there as a resource for your marketers, as a tool, as a person that can help them go out there and learn how to go past the objections and how to be able to create new sources. What you need to do also is to be able to assess their skills. And ultimately, the biggest assessment of their skills is, are they bringing in new referrals? Are they out there bringing in new clients for your organization? If you don't keep track of this, if you don't keep track on what they're doing on a daily basis, on a weekly basis, on a quarterly or a monthly basis, how do you know how successful they are? Now, look, you should not be keeping marketers out there if they cannot produce. And if you as a marketer cannot produce yourself after you've been given the training, after you've been given all the resources, unfortunately, this business is not for you. You shouldn't be in this industry. And at the same time, as an owner, you need to recognize the people. If they cannot produce within that 3 months that you have hired them, they are not worth the time to be part of your organizations. Most of the time, when you hire a brand new marketer, they are going to be able to perform above average on the first 60 days. Within that first 60 days, if they are not able to produce, I will guarantee you they will not produce for you for the rest of the time that they're working for you. So make a decision to get rid of them. Now, let's say, for example, that they are producing the first 60 days. I want you to pay attention on between the 61st and the 90th day, because I will most likely guarantee you that there's going to be a slump on their work. It's going to start decreasing if you do not provide them with someone who's there to talk to them, or whether you're there to counsel them to see how they're doing, because that is what's going to happen. We have what we call our 60-day slump, where after 60 days, good marketers or above average or even average marketers will start decreasing their potential, decreasing their work, decreasing their full potential. So you need to pay attention what happens after 60 days. But if within that first 60 days they're not producing, look, it's time to part ways with them, because they're not going to be able to produce and you're wasting your money.